Welcome to my Dentistry Tuesdays, and today's dental topic is implant dentistry. Before we get into it, my name is Greg Chong. I'm a general dentist for the last 25 years. Be sure and like and follow so you'll get notifications on future content that I release. Also, if you click the link in my profile, you'll see the very best products that I recommend completely on a daily basis. Now let's get into it. Implant dentistry or dental implants. What are they? They're basically a hollow titanium screw that we're able to screw things into it to put a crown on top to restore your tooth from root below the gums to the crown above your gums in complete form. We typically recommend them when a tooth is so broken down that we cannot fix it with conventional dentistry anymore, or maybe you have an ill-fitting denture and sometimes we can put some implants in to help stabilize it. And there's other situations where people's teeth are just completely failing because of gum disease and a lot of cavities. And we just pretty much have to take everything out and replace them with strategic implants. So then eventually we make a denture to fit that. And you may see commercials on TV for that. Clear Choice around the Bay Area here is a popular place to get it done. They advertise dentistry or you get your teeth in one day. There's more to it than that, but that's basically the concept. When we recommend a dental implant, what are you in for? What is the process? Basically, we have to take your tooth out that's damaged and we can't fix it. We basically put some bone grafting material in the area where the root used to be to preserve the socket or preserve the bone in the area. After about 3 months of that bone healing, the dental implant can be surgically placed. After that 3 months of bone healing, then we can construct the crown on top of the implant to restore your tooth in full function. So minimum, it's at least 6 months worth of treatment. You don't get your tooth right away for a single tooth implant situation. And I know the recommendation you've already heard, and they're very, very expensive. The surgery is expensive. The implant itself is expensive. The crown that I have to get from the lab, they charge me a lot for it too. And they're a lot of time. But I want you to think of it this way, where you're investing for a very, very long-term solution, almost problem-free. But the cool thing is you'll never get a cavity again, but it's subjected to gum disease still. With anything that we recommend treatment-wise, yes, it can fail. It can fail from a number of stages. One, right after surgery, maybe shortly after things have healed and somehow it fails, or we put the crown on top and maybe there's too much force load or something happens and it can fail. It also can fail from gum disease. So that's what we want to train you to how to keep clean. To prevent some of these failures, do ask your oral care health provider, how do you keep it clean? You can brush and floss it like normal, but there's an extra flossing technique that's kind of special to dental implants. I call it my shoe shining technique, and do ask your healthcare professional how to keep it clean, because maintenance is of the utmost importance to help make it last for a very, very long time. Some of the implants that I have in my patient's mouth, they've been there for 25 years and still going strong. So we do expect them to last very, very a long time if you help maintain it for us. In the end, I really love doing implant dentistry. It's very rewarding. It's at the forefront of dentistry today. I'm able to help my patients restore a tooth that really broken down, especially if it's a front tooth. We really want to aesthetically achieve a great result for the person as if nothing ever happened. And that's really fun and rewarding when that occurs. And I'm able to get the patient back up running and they're able to chew and eat whatever they want. That's so important. If you have any questions further about implant dentistry, please leave me a comment. I'd be happy to get back to you. Of course, if you have any other ideas that you wish me to present in the future, I'd love to hear from you as well. Leave me a comment. I'd love to get back to you. And if you might know a person who is undergoing a similar situation where a dentist is recommending a dental implant, be sure to share this video with them to help them understand what is going on. Thanks, everyone. Have a great day. Bye-bye.